Silverman has joined us as well. Madam Chairman, we are now streaming live on YouTube and we're ready to move forward whenever you are.
Welcome to the virtual MetroPlan Orlando Quality Assurance Task Force Workshop. I'd like to call the meeting to order. My name is Marilyn Baldwin, and I'll be chairing the meeting today. We will also have a team of folks working behind the scenes to ensure that this meeting runs smoothly. Today's meeting was advertised on MetroPlan Orlando's website and social media, as well as through targeted emails. Florida's Sunshine Law requires a quorum to be physically present in a room for a government meeting. Governor DeSantis suspended this requirement in an executive order, which allowed government boards to conduct business using virtual meetings. However, since our last meeting in October, the order expired. So this meeting is being held in a virtual workshop format. Staff will further explain what this means in just a minute. Now it's time for the Pledge of Allegiance today. And I'll ask Ms. Nika Berry to lead us in the pledge. Everyone else, please remain on mute. Ms. Berry, you're recognized.
Thank you. I
Lisa,
pledge.
can you advance the slide to the flag, please?
Ready? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Thank you. At this point in the agenda, I have the honor of giving comments. And my first comment is to thank our staff at MetroPlan that has continued to work tirelessly through this pandemic, through COVID, and of course, also the staff at Links. We do so appreciate everything that you've done. And I also want to thank all of our board members for your work that relates to the Transportation Disadvantage Program. Those of us who are clients, riders, we are dependent upon the services that your agencies provide. So thank you so much. And as an example of how our riders depend upon us, a couple of months ago, and I'm going to use a different name, Miss Long called me. Miss Long is legally blind and is a single parent and was having difficulty with her transportation to and from work. She is an educator and has a young child. So I contacted Links on her behalf to see if there was something that we could do. Now, understand that she does live quite a distance from where she works, but that's not uncommon for folks who are disabled, and in her case, blind, because we find employment wherever it is. And sometimes that doesn't always mean that it's close to us. So I was able to work with Norm and his team, and we were able to come up with a solution that will hopefully allow her to get to and from work during the rest of the school system. And the takeaway from that, as I said to Norm, was to please, maybe we need to take a few moments and check on our people who do work and who are using Access Link services to be sure that we are meeting their transportation needs. One of the greatest barriers to transportation for people with all types of disabilities, the barrier to that employment is transportation. So I really want to thank Norm and his staff for assisting Ms. Long with her transportation needs. Now, at this time, I'd like to ask Ms. Lisa Smith to take attendance. Ms. Smith?
Good morning. All committee members, could please go ahead and unmute yourselves now for the roll call. You can go on mute again after your name is called. Please make sure your video is on if possible so that we can confirm that it's you. You will find the unmute and mute buttons on the bottom left side of your toolbar. Please say here or present when your name is called. Marilyn Baldwin,
Present.
Chad Ballard,
Present.
Nika Berry,
Present.
Crystal Ford,
Present.
Mr. Hickling, Dr.
Present.
Levine. Sorry about that, Norm. Dr. Levine Silverman, Robert Melia, Wayne Olson,
Present.
Carla Radka.
Present.
Madam Chair, that concludes the roll call. Thank you.
Thank you, Lisa. Next, Ms. Whittington has some announcements and will review the agenda. Mrs. Whittington, you're recognized.
Good morning, Madam Chair and members. And for the record, want to note that we do have Dr. Linda with us this morning. So good morning to all of the committee members and all who may be joining us online, either on the phone or on your tablets. Thank you for joining us today. As Chairwoman Baldwin mentioned, I'll just remind you that the governor's executive order, which previously allowed us to hold our committee and board meetings virtually, expired last year. And the MetroPlan Orlando board, in order for us to continue our work, passed a resolution in December approving that all committees could meet in a virtual workshop format through June 30th. What this means is that a physical quorum is not necessary, but that no formal actions would be taken at these workshop meetings such as today. The items that are on the agenda will be presented for your review, and a report will be made to the TDLCB at its meeting that is coming up prior to them making their taking action on these items. So the items today are being presented on review and consensus from the QATF. The upcoming TDLCB meeting will be held in a hybrid format, which means that we would need to have a physical quorum in the MetroPlan Orlando boardroom. We will be physically distanced. We do have some upgrades that have been made to the boardroom, such as some individual places where you would be able to sit with stations that would allow you to speak directly into a monitor. The public is also able to attend these meetings in person, but they will be subject to the same requirements that those members are. And that means that they will be required to wear masks at all times and be physically distanced. We do, however, strongly encourage the public to participate from the comfort and safety of their homes. There is a number of ways that they can make public comments, which includes via telephone, email, or they can call in and raise their hands on the Zoom, using Zoom. To facilitate questions and comments from the QATF members today, we'll be using the raised hand feature. We ask that you please take a moment to locate that button. It's on the bottom taskbar of your Zoom screen. Members of the public who wish to make public comments will be recognized during one of two public comment periods later on the agenda. Members who've joined us on the phone only without video screen, you can use *6 to mute and unmute your line and *9 to raise your virtual hand. You'll see that there's a chat feature on your toolbar. This communicates with all panelists in this meeting, which includes the QATF members, staff, as well as the presenters. We ask that you only use this if you're having technical difficulties. In other words, no chatting between members. A full record of the chat comments will be included with the public record from this meeting. Today's meeting is accessible to the public by computer, tablet, or phone. And again, there will be two public comment periods, one in just a few minutes relating to items that will advance to the full TDLCB for approval, and the other near the end of the meeting for general comments. And we'll share instructions on how to do that when we reach that point on the agenda. A recording of the meeting can be accessed later on the MetroPlan Orlando's YouTube channel. Links to the YouTube channel and to the meeting agenda will be in the chat box for those of you who wish to use those features. This is also located near the bottom of your Zoom screen. Madam Chairman, lastly, before we move to the business of the day, we are prepared to move forward with the agenda as printed, but we have a new face with us today, and with your permission, I'd like to offer an opportunity, if she so desires, for Ms. Dana Baker to introduce herself. She is the new Chief Operations Officer with Links. And so Dana, if you would like, you can unmute yourself and just do a brief introduction to the Quality Assurance Task Force.
Hi, good morning, everyone. Thank you, Virginia. I am Dana Baker, Chief Operating Officer for Links. I have over 30 years experience in transit. Originally from Washington, D.C., I've been at Links now about 2.5 years. So I'm really excited to work with you all. And I look forward to helping you achieve all of your goals in the near future. So thank you.
Thank you, Dana. And Madam Chairman, that concludes the announcements that I have, and we are ready to move forward with the agenda.
Thank you, Mrs. Whittington, and welcome, Ms. Baker. We also look forward to working with you. We will now hear public comments on today's item for review and discussion. Again, the TDLCB will take formal action on the action items at their May 13th meeting. We will be reviewing them, and I will report out to the LCB. Do we have any people who wish to speak to any of these items? If so, please use the raise hand function found at the bottom of your screen, or by pressing *9 on your phone keypad. When we call your name, you will be asked to unmute your microphone, and we ask that you provide your name and address for the record. Please keep your comments to 2 minutes or less. Are there any comments at this time?
Madam Chair, there are no hands and no requests for public comments.
Are there any written comments that were submitted before the meeting?
We did not receive any written comments.
All right, very good. We have 2 items today that the LCB will take up as action items. May 13th, we will now review those items. The first is the review and recommendation of the draft TDSP minor updates. This is found in tab 1 of your meeting materials. Ms. Trish Witten will review the proposed minor updates to the 2020 through 2025 Transit Development Services Plan. Ms. Whittington, you're recognized. Ms. Whitten, you're recognized.
Okay, good morning. I'm Trish Witten. I'm Senior Planner at Links in the Strategic Planning Department. This is a review of the TDSP minor update. The major update was completed in 2018 through the period 2018 to 2023. So this is actually the 3rd minor update to that plan. There'll be one more minor update next year, and then we'll do our next major update the following year. Next slide, please. The TDSP, it is going to be reviewed and approved by the TDLCB based on a recommendation from this board, with the final approval being completed by the Commission for the Transportation Disadvantaged after submittal. There are 3 sections to the plan. The first section is the development plan, which includes roles and responsibilities, baseline conditions, needs assessment, goals, objectives, and implementation. So I'll just go through some of the changes this year, which are all very minor in this year's update. The first thing we did was change the certification page for the chairperson's signature. So following final approval, it will be signed for submittal to the TD Commission. We also updated the roster to include the most current membership of the TDLCB from March 2021. Within the introduction, we added a COVID-related action section. A large portion of mobility services work this year was around COVID-related actions, implementing safety measures for social distancing, safety precautions, and also operations, providing trips to testing facilities, vaccination facilities, as well as coming with procedures to transport COVID positive unhoused populations to rehabilitation centers. So we really wanted to highlight a lot of the work that's been done. The links organization charts were updated to reflect the most current staff, as well as the service area map is updated to show the most current routes. Part of this plan, we look at the local planning efforts that have occurred over the last year and just make sure that what's included in the TDSP is still consistent with planning efforts. So that section was updated to include the goals of the 2045 Metropolitan Transportation Plan, which was completed. The TDLCB certification was updated with the March 2021 version. And then we looked at the demographic summary. The latest data that's available is still 2019 American Community. So it's updated to 2019, but it's still really not reflective of what's happened over 2020. But we did update it to 2019, and that showed a 6% increase in the population over 2018 data, as well as a slight increase in the 55 and over population. And we also look at the Bureau of Economic Business Research projections out to 2045, which we did last year, and those haven't been updated. So that was still the same, showing Osceola County as having the largest population growth within the 3-county service area. Next slide, please. Same with labor force and unemployment data. That was 2019 is what we looked at, and that's showing our unemployment rate at only 4%, which we know with COVID is a little bit higher. So we also looked at the labor statistics, and I think it's more around 6.5% as of February 2021. And mobility services pulled the trip generators and attractors for 2020, so we can see where are the top locations that our TD passengers are going to. And that is still consistent that dialysis is among the most reached destination for TD passengers. The forecast of TD population we updated last year using the CTD tool. We did not update it this year because the Bieber data is still the same and the ACS data is 2019, and that model is not reflective of what's occurring with ridership based on COVID. And it's not a requirement for the minor updates. So we'll look at that again next year as more data is available. The needs assessment was reviewed just to make sure that we're still consistent with what's reported in the Human Services Transportation Plan, which is a document, as you probably know, that's included in the appendices of this report. So we looked at that, and it's still the main goal is to look at barriers to coordination and transferring anyone who's able to off of the costly paratransit system onto the fixed route. So we updated, added some text on a new technology that Lynx is developing. It's a general transit feed that will be available in May to third-party providers showing bus stop accessibility along the fixed routes. It's real time. So we wanted to include that that's being completed. It'll show sidewalk availability as well as any changes to wheelchair accessibility. We also included the TD eligibility that's been revised based on the working group and through this group as well as the TDLCB. Goals, objectives, and strategies are reviewed, and status updates were included. With what's gone on this year with COVID and safety precautions, we added some language on where we're at with these goals and objectives. It gave us an opportunity to kind of look at where we're at and what we can do moving forward through the recovery period. Some of the things that are included in the goals include public outreach and awareness. So when things get back to normal, we'll be back going out to community events. The How to Ride guide is in draft format and hoping to be finalized fairly soon. So we added some language reflective of that, as well as the days for complaints. Last year, the target was 14 days to resolve complaints, and we're reporting that this year we're around 9 days to resolve customer complaints. So we updated that section. And the travel training program, we had a goal to expand that, which we haven't really been able to under the current conditions, but we hope to in the near future continue to expand the travel training program. So consistent with that, the implementation schedule timelines were revised to push out those dates a little bit further. Next slide, please. The TD program eligibility section was updated to reflect the new criteria. With the 3 criteria, customers need to meet 2 of the 3 criteria without having access to the fixed route, have a disability, or be within 185% or below the poverty level. That section was updated to reflect that, and the subscription and demand response percentages were reviewed. This year, subscription trips were down compared to last year, and demand response was up compared to last year. So we saw that changed a little bit with the operating environment over the past year. The vehicle replacements, we reported that Mobility Services has replaced 1/3 of its paratransit fleet with new vehicles, as well as 100% of the NeighborLink fleet with new vehicles. And then the tables 10, 11, and 12 were just replaced with the most current information, which is the agency providers and the vehicle inventories. And then we included our latest safety system program certifications in there as well. Next slide, please. And these are within the service plan section. That's the second section of the document. There were no changes to the service standards, but last year, probably you all remember, there was a lot of discussion about call hold times, and customers were concerned about call hold times, and that reflected in the survey that was conducted. So we wanted to add some text in this year's update to report that call hold times are down 90% over what they were last year. And that's for a variety of reasons. Call volumes are down based on the circumstances, but it's also a 90% reduction in abandoned calls. And this is with the call center having moved remotely. We're seeing that reduction. So we're very happy with that. And then last year, we also reported that the web access reservation system had been implemented. So moving forward with new technologies, we'll be looking at different things like that, as well as remote work. The cost revenue allocation rate structure is a requirement each year that we look at that and develop new program-wide rates. And that is a separate item on the agenda. So Norm will be going over that next. So I'm just going to mention that that is included in this document. Next slide, please. And that leads us to the third and final section of the document, the quality assurance section. I know right now we're in the process of the CTC evaluation that's being completed by the TDLCB. So we noted that, as well as, I think last year when we were doing the update, it was in process. So I went ahead and added some language that May 2020 evaluation was completed and there were no findings that needed corrective action at that time. And so the final section are the attachments. We put in that new TD application that's been printed or is being printed, and that's in there for review, as well as the updated grievance procedures and those rate model calculations. And so that concludes, I believe, unless there's another slide, but I think that's it. That concludes our updates to this year's documents. If you have any questions, I'll be happy to answer them. Thank you.
Madam Chair. You may be, you're still muted if you're talking, Madam Chair.
I am so sorry. Thank you, Trish. Members, are there any comments or questions for Ms. Whitten? Is there any discussion? This item will be included in my report to the TDLCB. And next, we'll have review of the rate calculation worksheet. And Ms. Whittington is also, Ms. Whitten is also the presenter for this item.
Well, actually, if I may, Madam Chair, we'll just quickly go through it. It really was going to be something that I presented like I did last year. So
that's fine. That's fine.
Thank you, Madam Chair. So here is the rate calculation. You can see it's a comparison between FY 20 and 21 with the proposed rates for FY 21 and 22. As you all are very much aware that there is a extensive rate calculation worksheet that is sent out by the CTD, and we provide that to our finance team, who obviously take care of all the budgeting and take care of all the forecasting of cost for, purchase transportation, gas, operations, et cetera, all those things that are considered. So you can see the slight increase is a little over a couple dollars, from $39.53 per ambulatory rate last year to $41.94. And then the wheelchair rate, obviously that's on the bigger vehicles. So that went from $67.77 to $71.90. And you can see the percent increase. And so we're asking this for your consideration. The good news is we also, there's quite a step to go through getting it approved for submittal by the CTD. And we did get that word yesterday that they had looked at all the common mistakes that are normally made in doing the rate calculations, and they didn't find anything that was in error. And so they had, the CTD had approved for us to present this to you. So for your consideration to take this to the LCB. Thank you.
Thank you. Members, are there any questions for Mr. Hinkling?
Madam Chair, I don't see any hands, but I would like to just call attention to this item and just to remind all of the LCB and Quality Assurance Task Force members that what you see is the cost for those trips. That were it not for our funding partners, would be borne to the rider. So their rides are heavily subsidized.
Very good point, Virginia. Thank you.
It is so critical for you all to know this, so that when you are talking in the community and when people ask you and when people tell you that, they're paying so much for a trip, that, Lynx is picking up the difference on each of those trips. So, Madam Chairman, that's all I have.
That is so true, Ms. Virginia, and I think we don't say thank you to those funding partners enough. Is there any discussion? Okay.
Don't see any hands.
Don't see any hands? Okay. This item will be included in my report to the LCB. And next, we'll have our Lynx CTC update by Mr. Hinkling as well.
Well, thank you, Madam Chair. And I think we'll go ahead. If you go to the next chart, that is the cover page. And once again, we'll try to cover some of the things that we've talked about in the past and kind of give you an update as to our performance and some analysis as to what has happened as far as trips and the demand for trips. The funding allocation, call center performance, and the eligibility status, and then give you some update on some of the different initiatives. And a lot of them, Patricia has already talked about. So Patricia did a great job. So I'll spend less time on those, but we can go to the next chart, please. Again, very busy, and we'll break this down, but in March, we performed 42,656 trips, what was a pretty dramatic increase from what we saw in January and February. In both of those months, we had seen a bit of a decrease in ridership, and so March was busy for all of us, for our contractor, for the team here. With that, you can see the dialysis trips were right at almost 15,000, which was about 35% of all the trips that we performed. Employment trips, and again, goes back to Chairman's comments a little earlier about checking on how we are performing on folks with their employment trips and making sure we're getting them there on time, getting them home in a reasonable time, et cetera. That's 26.5% of the total trips. That's 11,316. And then when you go down to medical, that's right at 6,000 trips, which equated to about 14%. So, you know, between the 35% and the 14%, you can see a good half of our trips that we perform on any month is always related to a medical need and a medical necessity. So again, it goes right back to being part of that medical industry out there, getting people into their trips. So we'll break this down a little bit further with the next chart. This shows a nice year-long trend where we were back in April of 2020, right in the midst of the COVID pandemic, at 26,469 trips. We're now here in March, 42,656, and we're seeing about the same number of trips here in this current month as we saw in March. So while it's gone up, it's kind of a new plateau or stabilization there. I don't know if that has anything to do with the number of trips that we performed, or people feeling a little bit more comfortable. So we are still looking at that data and trying to make sure and trying to forecast for the future. Next chart, please. As far as trip performance, funding sources and client analysis, ADA trips last month in March was 27,073. The TD trips, it was 15,138. And then we had quite a few trips that we performed on behalf of the EOC, and I'll talk a little bit more about those vaccination trips. We had functional assessments, and we still do some things with health services that we take care of some of those folks that have to get to counseling and or medical trips, et cetera. So, and as Patricia mentioned, in March, the demand trips were much higher than the subscription trips, and 27,000 versus the almost 15,000. And then you can see the will call and the functional assessments down on the bottom there. Will calls are those trips where somebody has to make a change in their schedule. They're scheduled for a 1 o'clock pickup, and maybe dialysis doesn't get done on time for them. And so they have to make a request for a will call, which allows them to get picked up a little bit later time, but we do get them home and make that adjustment. It takes a little bit, but the team does a good job in trying to accommodate those customers. It's not an on-demand service, but we do try to make those adjustments where feasible. Next chart, please. Again, trip performance, trip purpose analysis. You can, on the very top there, by far, again, 35% of our trips in any given month is related to dialysis. And so, we are keeping people alive. And there is quite a list there: employment, personal, recreation. And for those, we break this chart out so you can just see what people are doing. Still, the biggest drivers are the dialysis, the employment, and even the recreation we're starting to go up. And again, that's most likely due to people feeling a little more comfortable, a little more able to go to different things, whether it be going to dinner with friends or going to religious services, etc. So we're starting to see a growth in that area. Next chart, please. As we've shown in the past, the call center performance and the total calls per month, we have here 2019, 2020, and 2021. And we really wanted to cover these 3 years in particular because we know that there was so many concerns in the past, and there was something that was a major focus for the mobility services team to try to go address it. And we tried to address it going through the pandemic. So that was quite interesting. But the red line here, it shows that in March we had 53,000 calls. We're still 12% higher than we were obviously from March of last year, but that was again in the pandemic. The good news is the team is continuing their performance. One of the questions that this group and task force had asked in the past, as had the LCB asked, is do we have the technology in place to maintain the good performance on call answer rate when the demand starts going up? And you're going to see just a minute that the team has done a real good job in maintaining that. It's a little higher, but it's still well within what the goal has been established for our answer rate. So real proud of them, and they're doing a good job. Next chart, please. And this is where Patricia alluded to in the service plan. In 2020, our average answer rate was 6 minutes and 23 seconds, whereas in 2021 here, we are looking at 1 minute and 5 seconds. So again, the numbers are going up, and that's what that chart on the right reflects, that in 2020, in the March timeframe, we had 47,647 calls, whereas in 2021, we had 53,240. But even then, with that increase in calls and related to what it was a year ago, we've done a much better job in answering the phones and being able to handle calls and get people to where they need to be or address their issues right away. Excuse me. Next chart, please. This chart reflects a lot of what we have just talked about, the 1 minute and 5 seconds. You can see on different days during the month that some days are a little higher than others. You get some heavy days. A lot of times the Monday, the Wednesdays, and the Fridays are heavily traveled days. And so those most likely are reflected here in this chart. With the technology that we have and with the one provider and everybody being able to access and see where trips are on the computer at any time, we can handle and really let people know where their ride is, etc. And that's made it a lot faster for us to answer questions coming from our customers. So the total handle time of 4 minutes and 17 seconds is very good. I think the thing that, and was alluded to a little bit by Patricia, if you look at the handled calls was 50,130 for the month of March, and only had 5% or 3,110 that were abandoned, meaning somebody gave up on the call because it was taking too long for them. So, and as you recall, and you aptly reminded us many, many times in the past that this task force has, that that number was much higher. So again, the team has really addressed it. They've really bared down, and it's showing fruit in their efforts. Excuse me. Next chart, please. We like to break this down for you so that you can have an idea of where the calls, what are generating the calls. Still, the highest number of our calls are for ETA, wanting to know where their ride is, what time is it, etc. And 25% are for actually making the reservations. The others kind of make up, you know, customer service and eligibility calls and NeighborLink and Lost and Found. So the goal this year and going into next year is to really work on how we address those estimated time of arrival calls and get that information out. And again, I think I'm going to talk a little bit about in some of the things that we're doing and the status report of the new phone system, the new customer service contact system that we're working on to put out in the public and get proposals on. A lot of it is geared towards how do we reduce the number of calls that are necessary, and we can get that information out so somebody can find where their trip is. Next chart, please. Eligibility and application processing. We talked a little bit about the fact that the new TD application is being implemented, and we are going to print with that as we speak, and you'll be seeing a letter coming out letting folks know that that's going to be implemented, and that will be on our website very, very quickly. So anybody that wants to get a new application for the TD program will be under that program. So again, thank you to all the workshop members who made that happen and all your ideas and inputs. We will be reaching out within the next week and prior to the LCB to schedule another group of workshop meetings so that we can go address the ADA research process. That's something that we have promised you. It's been requested by you all, and we're going to get going on that because you can see that's a real good area of where we can still speed up the process. You had 262 or 261 individuals that were going through the ADA research process during the month of March. And we know not every person in that will be able to have the streamlined ADA recertification system, but those ones with the permanent disability will be able to. So we know that there's a good group of people that will greatly benefit from a streamlined process. So we're looking forward to getting that started. So next chart, please. Now, some of the program status and initiatives at the last Quality Assurance Task Force and LCB meetings, you had asked a question about the no-show counts. Well, for March of 2021, we had 1,760 no-shows, right? A little less than 4%, which is dramatically down to from what it was. If you recall, in the past, there was well over 3,000 at times in some of the months that we reported. So again, good improvement, a lot of attention to it, a lot of investigations and a lot of analysis as to why people were missing their trips. Again, a lot of it has to do with, I think, to a certain degree, a lower demand, but also having one carrier so that we had better control and we could let folks know exactly where their trips were. You also asked about uncollected fares for March, or where we were standing. For March of 2021, we were less than 2% of uncollected fares, was right at $327. So again, a very manageable amount, not perfect, but a lot better than it had been in the past. And then finally, there was a question in regards to the 1MV application. This is on the website that somebody can get signed up for, and you can go in and actually track your trip if you are willing. We in January of this year, MV updated their system on tracking their trips and tying it to the Trapeze system, which we use as our software. I apologize. All of a sudden something got in the throat there. And so we have, it's much better. If you used it in the past, the new one's much better. It gives you more real-time data, and it's not so slow in updating as the past one was, but you do have to go through and re-register for it. So I would hope you'd be able to take advantage of it. And again, that would help us address some of those ETA calls coming in and asking for where their trip is. We have done on behalf of this community, now it's well over 700 vaccination trips. These are trips to and from vaccination sites, going out to the Orange County Convention Center, where we actually drove through the line. We never asked the passenger to get out, and they were able to stay on our vehicle, whether they were by themselves or in a group that came from the same residence, and they were able to get their vaccinations. We did it for the first vaccination. We also did it for the second one. So we're real proud of that. We did that both for Orange County, and we did it for Valencia College West, and it worked out very, very well. We're putting that together. We continue to work on our COVID-19 testing trips for folks that are asking for those. And even like in our dialysis patients that need dialysis, yet they've tested positive for COVID, we've been able to segregate them for the short period of time, whether they had any kind of symptoms or not, and still get them to their dialysis, which we knew that was a critical need, but we made sure that we had the vehicles separated, et cetera, and so that we had the, meeting all the CDC guidelines, making sure that we're not out there being a spreader by any stretch of the imagination. And the good news is we're very close that the RFPs, or request for proposals, are now getting ready to be released for the new phone system here at Lynx, and also the new customer contact center. So the good work that the team has done with the technology that was supposed to be on more of a temporary basis, we've continued that on, but we'll even improve as we go forward, because we know the demand for calls and trip demand is going to continue to increase. So we're really looking forward to getting that new system in place. Next chart, please. We had talked about surveillance cameras on all our paratransit vehicles. I'm glad to say that the RFP, the request for proposal, has now been issued to the street. And so we're going to have companies bidding on this project, and we'll go through that whole selection process of who the right contractor is, and then be able to start getting the surveillance cameras installed onto our paratransit fleet. This is not only going to help our customers, it's going to help our operators, and it's just going to improve the safety of these trips all the way around, because they will be dynamic and they'll be out there all the time, whereas be a big improvement over what we have right now. As we've already talked about and won't spend too much time on, we've implemented the new TD application process, and then we want to get the working group going for the ADA recertification process that we've talked about. And just a little note down below, of the 8,734 eligible Access Lynx ADA clients that we currently have, we know that there's about 1,200 or a little more that would really benefit from an expedited ADA recertification process. So we know that's a good number, and that will really help our clients, but also help us a great deal. So, and then lastly, last chart, please. And we've talked about it, 63 new paratransit vehicles on site. The last one we just received this week, and it's getting ready for revenue service. And we already have another requisition going in for 19 new vehicles, which will come in the months to follow. And then going into the budget for next year, we're looking at ordering another 15. So we are really trying to work very, very hard to update our fleet so that it's clean, they're safe, and they're provide the best convenience to our operators and then our clients, more importantly. So with that, that concludes my remarks, and open for any questions.
Very good. Thank you, Norm. Do we have any questions for Mr. Hinkling? If so, please use the raise hand button and unmute yourself when recognized.
Madam Chair, you have a hand by Dr. Linda.
Dr. Linda, you're recognized.
Hi, everybody. Norm, I got to tell you, I'm sitting here with a grin on my face. I am so impressed. I'm so impressed. I'm so excited I could cry with all these things that you're doing and doing it, you're rocking and rolling, and between procuring new vehicles with the work you're doing and the times and everything, I'm just like overwhelmed. Oh my God, I can't believe I'm emotional about this. And I'm really excited to be, looking, I know, because it's been a long time coming, and I have being in the population that I serve, as well as in the disability area, it's personal too, I talk to a lot of people, especially in this over 55 place I live in. This is amazing. This is amazing. And you're doing a great job. And I just wanted to tell you that. So thank you.
Thank you, Doctor. Appreciate it. And I'll share that with the rest of the team. And a lot of them are listening to it, but it's a team effort. But thank you very much.
Madam Chairwoman, you have a hand by Ms. Berry.
Ms. Berry, you're recognized.
Thank you. I really want to just echo the sentiments of Dr. Silverman, because I commend you all for all that you're doing. The improvement, it shows, it's beneficial, and I know that a lot is going into it. So thank you to both you and your team. It's definitely appreciated, and good job. It really is a lot to be emotional about, because we see the improvement. So thank you.
Thank you. Thank you very much.
Very good. Norm, excellent job. Do have two comments for you.
Yes, ma'am.
The first one is, of the vehicles that you've ordered, your new ones, how many of them are the little vans?
None of them. No, the ones
Thank
that all 63 are what they call Vanteras, and
Yes.
they are made by Turtle Top, and they're the bigger ones.
Very good, because I've had a lot of comments from folks, especially during COVID, saying that they don't feel comfortable riding in those little mini vans and being social, not being able to be as socially distanced as they would like for someone they really don't know. Good to hear that. My other question is, and now it goes right off at the top of my head. I'm sorry. Okay, now I know what it is.
Okay.
You've done an excellent job reaching out to Orange County for our vaccinations. What about Osceola and Seminole? Have they not requested our assistance?
And I'm my air. We have been providing vaccination trips to Osceola. It's been a little less in numbers, but they do have a vaccination site in the same format. We do the drive-through for them. We haven't had too much request from Seminole County, although Virginia knows that we did get a request from the Center for Independent Living, and we had a couple clients from Seminole County that we were able to take care of and just fit them in, and they were very happy and appreciative. So my apologies, we do cover Osceola.
Very good. Well, I thought so. So just wanted to bring that to your attention.
Thank
Any
you.
other hands, Mrs. Whittington?
No other hands, Madam Chair, but if I may add my voice to the chorus of those who are passing along these wonderful accolades to the Links team. They have certainly been a great partner in working through these requests that have come, and anytime we receive comments or concerns from the riders, they have been very, very responsive in following up on those, including the relationship that we've established now with the Center for Independent Living. The person who they helped through that instance was very, very appreciative for the follow-up. Just wanted to ask one question about the 1MV application and how MetroPlan Orlando might be able to help get the word out about that. If the goal is to move the needle on that expectation of the ETA, it would help if people know that that's available. And so we can help shoot the word out on social media. If you all have a campaign or a program that we can help get the word out to at least to the transportation community.
We have a flyer, so we'll send that to you, Virginia. So thank you very much. Yes, we will send a flyer. We did do some seat drops in the January timeframe, but it's most likely a good time to reestablish that contact with the riders and get that information out there. So thank you. We'll do that.
Sure. Well, we'll be happy to post it on our Facebook and send it out Twitter.
Excellent.
Very good. Very good. Are there any other questions or comments?
I don't see any hands from anyone.
All right. Then this concludes today's presentations. Are there any committee members who have final comments? If so, please use the raise your hand function and unmute yourself when you're recognized.
Don't see any other hands. Just give it a
All right.
second. Nope, no hands.
It's now time for public comments. If any member of the public wishes to make a comment, please use the raise hand function and you will be recognized, or dial *9 on your phone keyboard. We'll unmute your mic. After you're recognized, please state your name and address for the record and limit your comments to 2 minutes or less. Are there any comments at this time?
Madam Chairwoman, we do not have any comments from the public or any requests.
Are there any written or phone comments?
We did not receive any ahead of the meeting, no.
All right. The next meeting of our QATF is scheduled for July 27th, and staff will let us know whether we will be in person or it will be another virtual workshop. And at this time, if there's no further business, we stand adjourned. Thank you very much.
Thank you, everyone.
Thank you, everyone. Have a good day.
Thanks, guys. Have a
Great
good
meeting.
day.
Bye.
Thank you. Bye-bye.